Hello, my name is Dr. Jackie Muir and I am one of the Chief Medical Officers for Suffolk Primary Care and a General Practitioner at Coombsford Surgery in Stowmarket, Suffolk.
Jackie, can you start by telling us why it is important for you as a doctor to have access to the full record when you're seeing a patient?
Yes, when I'm seeing a patient, it is really important to have access to their past medical history, what medication they may be taking, and any reactions to the medication which they have had in the past. When I see the clinical record, I can get a feel for the patient's past history and also information about any recent consultations with other doctors or nurses. I can also get access to their hospital letters. All of this enables me to form an opinion or diagnose the patient much more effectively than if I am not able to have that information.
And for the patients, how does sharing the record help them in terms of the consultation they have around their care?
Sharing the record means that any doctor who a patient consults can see their past medical history and their medication without the patient having to remember what their diagnoses are, what procedures they may have had done to them, and what medication they have taken in the past or are currently taking. Sometimes medication names are quite long-winded and difficult to remember. The patient may not be feeling 100%, which is why they are being seen. So the ability for the doctor to see all of the information and confirming with the patient that it is correct is really helpful. If medication is prescribed, the computer will automatically cross-check that against the medication which the patient is taking, so it makes it much less likely that a mistake will be made or a drug interaction will be missed. The patient may have an allergy which they have forgotten to mention, and the computer will prompt the doctor with that information.
Should patients be concerned about sharing their record?
No, I don't think they should. Data sharing in the NHS is controlled very strictly. Data is only shared between organisations who have a need to know that information about the patient, for example, clinicians actively involved with that patient's care. All staff working with the NHS are aware of the strict rules regarding data security and confidentiality for patients, and that is taken very, very seriously. So I do not think that patients need to be worried that their information is going to be abused. Audits are undertaken to ensure that only the right people who need to look at that information are actually looking at it, and in fact it improves patient care when they allow other clinicians to view their records.
Can you tell us how sharing works within Suffolk Primary Care?
Your GP surgery has the facility to turn on sharing of your GP records. This can be done for one clinical episode or can be ongoing. You can choose which. You may be asked for permission to do this the next time you are in contact with your GP surgery. You will also be asked to do this if you require to be seen by a clinician who works for GP Plus, the pre-bookable out-of-hours service which is staffed by local GPs and nurses. If you have not been asked to share your medical records but would like to do so, please pop into the surgery or contact them by telephone and ask for this to be done.